Now we'll have it and actually talk about two types of pelvic inflammatory disease. So this is the acute and the chronic type of pelvic inflammatory disease. Now for this one, it's just a classification of pelvic inflammatory disease, and this is basically based on the timeline to how the disease occurred or so, you know. So acute, anytime you hear acute, of course the thing is happening so quick. While if you hear chronic, it actually took time for it to actually come in. So for acute and chronic pelvic disease, first of all, you should know that pelvic inflammatory disease is an inflammation. Okay, it's an inflammation. It's an infection of the female upper genital tract. So you have several structures being inflamed, like the uterus, the fallopian tubes are inflamed, the ovaries are inflamed. Okay, so it can present in different forms. Acute, happening so quick. Chronic, it took some time. Where it's a subclinical, that one you can't really pick up. The patient is not feeling issues, although the disease is there. It's just mild, you know. So breaking them down, the acute one is sudden and severe. It's happening so quick, and the patient is feeling intense pains and all of that. So you can have low abdominal pain or pelvic pain, fever, abnormal vaginal discharge, pain during intercourse or urination, irregular menstrual bleedings. Okay, so it's often linked to sexually transmitted infections. Okay, so you can have infections from Chlamydia, trachomatis, Neisseria, gonorrhoeae. So diagnosis is based on the issues that the patient is complaining about. These issues we listed, you pick them up. All right, they sometimes can do imaging, then sometimes from pelvic examination. So treatment is you are dealing with a bacterial infection, so you know antibiotics should actually help, okay, the situation. While when you say chronic, the infection came in, but it was actually gradual and persistent over months or years. Okay, so there's chronic pain, the person has been feeling it for a very long time. Probably the disease has been coming, it remains silent, still come back, you understand, so it's recurring. So of course such a patient should not be able to pick up pregnancy from the issue. Okay, he's weak and there's low grade fever, because the microorganism can gradually creep into, you know, your bloodstream. So causes is due to untreated or inadequately treated acute pelvic inflammatory disease. So diagnosis is challenging. So you might actually need imaging to look at all the damages that have been caused to structures there. So treatment, as the disease is a long-term disease, you also use long-term antibiotics, you know. So that's just it for the difference between these two types of these two types of pelvic inflammatory disease, the acute and the chronic type.